Hi, everyone. Welcome to Tetratherix podcast style investor update video. This is our first time that we're doing in this style, so please bear with us. I'm Fathi, CTO and founder of Tetratherix, and inventor of the background technology that we recently used to develop our new hydrogel spacer, Tutelix. And in collaboration with our JV partners in Tutelix, we just recently have data readout from Tutela, our first in human clinical trial of this technology. Today, I'm joined by Dr. Andrew Orr, lead radiation oncologist and principal investigator for the Tutela clinical trial. Andrew, thanks for joining us.
Thanks very much, Ali. Pleasure to be here.
Awesome. So, Andrew, let's just start with one line or so. I'm not going to count lines. What are the key takeaways from this is stage 1 Tutela clinical trials that you can share with us?
Yeah, so I think the key takeaway from the stage 1 of the trial is really related to the safety of the device insertion. So we had a protocol planned safety review meeting, and to date we haven't had any procedural related adverse events, and this gives us confidence to proceed to stage 2 of the stage 2 of the clinical trial, which of course is a pleasing result. All the patients to date have completed at least 28 days follow-up, and to not have identified any procedure-related events is wonderful and gives us confidence to proceed.
Amazing. So Andrew, if you don't mind, can we just go one step at a time? So I believe you were in the theater during the product insertion. Walk us through what you saw during that sort of like initial administrations, because it was the first time that the product was used in patients. So can you walk us through what did you see during that product insertion phase of the clinical trial?
Yeah, for sure. I was in the theatre for the cases that have been recruited on the Tutela trial to date.
Mm-hmm.
So what we have noticed is that the gel, obviously it comes as a liquid, which means it can be injected through a needle, and then it appears to transition to a gel very quickly in vivo. So that's important. It means a clinician can inject it through a thin needle without causing too much local trauma. Secondly, what we have seen is that the prostate is visible when we look at the during the procedure. So when this procedure is done, it is done under what is called a transrectal ultrasound. Basically, that's an ultrasound looking at the area where the injection will occur. And pleasingly, we can see through the gel beyond the gel, and that gives the clinician confidence during the injection. Obviously, being able to see where you're injecting is favourable for insertion procedure like this one.
Okay, that's very interesting. So moving on from that insertion phase, you said that all the patients came back at least for 4 weeks, like 28 days after the initial insertion. So how did this spacer behave during that sort of like the radiotherapy course of the patients that you've seen?
Yeah, one of the probably one of the more critical aspects of radiotherapy treatment is reproducibility from day to day. So patients come in and we'll have a session of radiotherapy treatment. I mean, radiotherapy treatment courses can be anything from 1 session out to 40 sessions. In this particular study, it's 20 sessions. And so far in our patients recruited, what we have noticed is that the gel remains stable throughout treatment. And this is really important because we know that there are anatomical changes or device changes during radiotherapy treatment that may trigger a requirement to do a remapping or replanning. And so far what we have seen is that the gel maintains a very consistent size and shape throughout the course of the radiation treatment. Obviously, we'll continue to assess this in stage 2 of the clinical trial.
Amazing. So, like we're doing all this for patients. So if we want to talk about patients, so any measurable, semi-measurable, semi-quantifiable inputs that you can have in respect to the patient's comfort? Was there any sort of like a report of a discomfort or anything in that nature for the patients that are being treated with the product?
So we have not noticed any adverse events related to the insertion of the device. And this was the critical aspect of the safety review meeting, which was successfully completed last week. But, as far as toxicity beyond that, that is something that we'll have to continue to assess moving forward. Radiation toxicity can be delayed for weeks or even months following radiation. So that's something that will be assessed in an ongoing fashion. But so far, the gel appears to have been tolerated very well and has maintained its size and shape, and this is pleasing.
Amazing. So if you compare this sort of like the comfort of a patient to the cases that they wouldn't being inserted the hydrogel spacer, we can we do a little bit of elaborate a little bit more in that respect at what was expected without the hydrogel spacer and what was the outcome with the hydrogel spacer now?
Yeah, so we know that radiation dose, the more radiation dose delivered to the rectum, the greater the risk of side effects. And so far in the patients recruited, we have noticed that the high dose radiation is able to be separated from the rectum. So the rectum or bowel is not receiving the radiation, the high doses of radiation that we would correlate with toxicity. Whether this will result in reduced toxicity, I mean, in other studies similar, it has done so, but that is something that we'll continue to monitor.
Okay, amazing. So that's the stage 2, sort of like of the clinical trials that you mentioned. So anything that we should expect as a clinicians, scientists, investors about this stage 2? Any timelines or next phases that we need to have an eye on?
Yeah, so now that we have completed the safety review meeting, we have confidence to commence stage 2. And stage 2 will continue to recruit patients at a number of sites across Australia. We are actually expecting recruitment for the Tutelix trial will occur very quickly. So we are hoping that trial recruitment and insertions will be completed in the next 2 or 3 months. And sort of concurrently with that, we now have confidence in, at least preliminary confidence in the device performance, that we will commence pathways for our larger trial, which will be a international trial likely in Australia and the United States. So we now have the confidence to commence stage 2 as well as plan for a large pivotal trial, which will probably occur next year.
Amazing. Thank you very much, Andrew. Andrew, final notes, one sentence summary focusing on the patients, if you want to share with us.
Yeah, I would just say in summary, very pleasing early results. The gel has performed very well. The procedure has not caused any problems. We think that the gel has performed as expected and there's not been any surprises. As a clinician, we're very excited to commence recruitment in stage 2 of the trial and hopefully get some more data, and hopefully it continues to be pleasing.
Amazing. Andrew, thank you very much. And thanks to everyone for listening and watching this short video. If you want more information about this clinical trial, please reach out. Please check out our website, and we'll be more than happy to contact you with our joint venture partners in Tetra, in Tutelix. I'm Ali Fathi, and this was our first podcast-style investor video. See you next time. Thank you very much.